So I just came in my patient's room. We're going to change the IV dressing today. It's been 72 hours and that's our hospital protocol. So the first thing I'm going to do is, like I said, come in the room. I'm going to make sure I identify the patient using 2 identifiers, name and date of birth by the wristband. I'm going to let the patient know exactly what I'm doing, explain the procedure to the patient, make sure that they, like I said, know exactly what's going on so they don't get scared. I'm going to go wash my hands, and then I'm going to apply my safety equipment. I'm going to have my goggles, some nice clean gloves, and then I'm going to check the site for patency. So I have my flush here. I'm going to take the cap off the flush, and then I'm going to make sure I get all the air out of it because I don't want to inject air into my patient. And then I have 2 alcohol swabs or 2 chlorhexidines. I'm going to put my flush back down on the plastic part so it's not touching anything. And I'm going to check the IV for patency. So I'm going to clean the area, nice and clean. Like I said, I've already expelled the air. I'm going to stick that in, and then I'm just going to flush it. It flushes great. The IV is patent, and there's no redness, swelling, or anything like that. I'm going to ask the patient if they felt any pain, and the patient denies any pain, so that's great. So now what we're going to do is we're just going to change the dressing. So I'm just going to remove the tape here. And so when we're doing this, we want to make sure we're really careful not to dislodge this IV, make sure that it stays flush with the skin, because nobody wants to have to be poked again for no reason. So once I get everything off of the IV, I'm going to inspect it once again. Like I said, it looks great. So I'm going to take a clean chlorhexidine, I'm going to break it. I'm then going to clean the site all the way around underneath it. Everything looks great. And so then at this point in time, after I've done all that, I'm just going to redress it. Possibly. Well, stain tape and I do not get along. Okay, there we go. So we're going to wrap it around. Like I said, we're not going to put it over the area of insertion. Put the chevron there. I'm going to get a new tegader, and I'm going to put it over not where it screws in. I'm going to make sure that it only covers the point of insertion. This is to help prevent infection. And as you see, before I take this down, I have my name and my name, time, and the date of when I changed it. Okay. I'm going to get new tape here. Okay. I'm just going to tape this down again to make sure it can't be pulled out. Perfect. And you can always have extra tape because it's never going to hurt. And this one's just a little bit flimsy, so I just want to make sure that I secure it real well so the patient doesn't pull it out. And then at this point in time, after I'm done, I'm going to let the patient know to let me know if they have any warmth, any pain, any tenderness at the insertion site, and then I'm going to go document everything that I did, and that's everything. Thanks.